Well, as we just mentioned today, the state reported 120 new deaths from COVID, the highest single-day increase of deaths since the outbreak began in March. We wanted to give you a better understanding of exactly what that means. And let's go now to Fox 13's Justin Matthews live in Tampa. So, Justin, health officials say these daily numbers don't reflect people who actually died today. Explain this for us.
Yeah, Kelly, it's a little bit confusing. Public health experts say those death tolls that are reported daily reflect up to a week's worth of cases, and that's because it takes time to process that data. Amid a surge in COVID-19 infections, the Florida Department of Health reported Thursday 120 new deaths, the largest one-day spike in deaths since the pandemic began. But that number is not reflective of who died in the last 24 hours.
What we're seeing in the death numbers is really reporting what was going on in the actual dynamics of the infection probably about a month to 5 weeks ago.
Dr. Thomas Unash is a public health professor at the University of South Florida. He says, on average, it takes about 1 month for someone to be infected with COVID-19, show symptoms, go to the hospital, then die from the virus. He says it then takes another week or so for local health officials to report the information.
You're looking in the rearview mirror, and it'll tell you where you've been, but it doesn't help tell you where you're going.
The latest statistics from the Florida Department of Health show 35% of COVID-19 related deaths are people 85 or older. Deaths for people between 25 and 34 years old is only 1%, despite that age group currently having the most positive cases. While the state updates COVID deaths daily, health experts call it a lagging indicator.
Unfortunately, it's not telling you what's going on now, which is what you really want to know. It's telling you about history. And history can be important, looking back to figure out how the epidemic unfolded eventually and how many people it actually affected.
In Florida, the COVID-19 death toll stands at 4,000. Half of those deaths are from residents and staff at long-term care facilities. And USF's Dr. Thomas Unash says that patients who pass away from COVID-19 this week, their cases won't be reported likely until the end of this month or even the beginning of August. Kelly?
All right, Justin Matthews reporting for us. Thank you, Justin. And we do want to take a moment to explain the